Did you know that most adults will struggle with sexual issues at some point in their lives? And today, that's what we want to get into. So welcome back to the channel with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Faraday Goli, nurse practitioner here at Revitalize MD.
So today we wanted to talk about something we talk to our patients about on a daily basis. And that is the fact that most adults at some point during their adult life will have some issue that they're struggling with related to sex. And so it happens to men and to women, and they're different issues. And so they come in with different issues. But the big problem is they don't have a lot of places to turn to have those conversations. And so what do you think one of the most common things that we hear on a regular basis would be?
So probably for men, it's they spoke with primary care. Most men aren't seeing a urologist for sexual dysfunction unless they have something going on urinary related and their primary has sent them because they're worried about a potential prostate issue or something else going on. So I would say for men, I would think that the most common is probably primary if they have that conversation at all. A lot of men are less likely to open those conversations because they're not comfortable having those conversations. For women, GYN.
Yes. And so I think that what we're finding, and even at younger ages, is that they don't get a lot of answers and those conversations are shut down very quickly. And so there's never an intake into the primary care doctor's office, the gynecologist or urologist that actually includes questions related to sex. Like, how is your sexual function? You know, how are your erections? How are your orgasms? Do you
Are
have a
you
sex
satisfied
drive?
with sex?
Yeah.
How's your libido?
Yeah. And so we would love to open these conversations in the comments to just see if anyone is experiencing something different than we hear on a daily basis. But I will say that the stats for sexual dysfunction for men and women are quite alarming. So, between 30 and 40% of men by the age of 40 have had some issue with erections. And so that's
Think
huge.
about that. That's almost half by the age of 40.
Yeah.
That is so young when you think about that.
And when we talk about sexual, like a erectile issue, changes or issues that men might be experiencing, it's anything related to a decrease in your sexual satisfaction. So that could be, I'm just having a difficult time having an orgasm. And so that it's going on for a long period of time at the dissatisfaction of the man and sometimes the women as well. And so that could be as simple as that, or just not consistently getting or keeping an erection. But I think that delayed ejaculation and decreased sensitivity is a huge issue, and therefore just interfering with satisfaction.
And that seems to be something we
experience.
hear a little bit more in the younger population versus inability to get or maintain an erection and with our older men.
Yeah.
That seems to be a little bit more of the difference between those age groups.
And that's 30 to 40% of men by the age of 40. And we approximately say about 50% of men at 50, 60% at 60, and 100% of men at the age of 80 and beyond. So again, something that increases in incidence, but it's alarming because a lot of patients don't have a place to go to talk about that. So I would agree, though, that most men have had that conversation probably first with the primary care, referred over to urology, usually only if it involves something related to the prostate, though, or urinary symptoms. Then they refer over.
Other than that, they just kind of write a prescription for some Cialis or Viagra and potentially check hormones, but oftentimes I have guys that are like, yeah, my doctor just wrote me a little blue pill, and we don't really talk about it beyond that.
Yeah. Well, and so if you look at the stats for women, it's even higher. And so 40 to 50% of women will have some kind of sexual dysfunction.
And that can be libido. That could be inability to orgasm, delayed orgasm,
Arousal,
lubrication. I mean, there's a lot with women that go into sexual dysfunction.
Yeah, it's across the board. So it could be a low sex drive. Yeah, the arousal, they're just not getting stimulated as usual, or that orgasmic strength decreases with age. Pain being the worst thing. The pain is the one thing that they probably can't fake. But otherwise, I think the alarming thing for us and what we wanted to bring up is we're open to having these conversations, not only in the office, and we think it's super important that men and women have a place to go when they have questions related to sex and be able to have those conversations and get solutions that they're not finding in traditional medicine. And so where are they having conversations? We would love to hear this. Like, I don't think, and I think that we've talked about this many times, but this was an impromptu podcast right now just because she sees patients all day long and so do I. And so just kind of comparing if there's something new, that we're seeing now that it is, probably a year since we've had a conversation about it, but men aren't having it with their buddies. They're not
No.
talking to other men.
Men have not become enlightened. They are not having these conversations.
No.
I think if they're having conversations, they are not around what's not working.
Yes.
It's around what is working.
Correct. Well, and that's why I would always argue that in the ER or even otherwise, that you can almost, divide by a third the sexual partners for women. It's, more of a joke. But again, if you ask a woman how many people she slept with, you can probably, triple that. And if you ask a man, you can probably divide that by a third. So the opposite. So I think you're right. It centers around things that are going right.
Yep.
And not around things that are going wrong. And so when a man has questions or issues, who's he having those conversations with? And I think it's super important in medicine that we infuse that sexual wellness and satisfaction and solutions into medicine.
Absolutely.
So they have a place to go.
Exactly. I know the guys that I've spoken with in clinic, and I'm sure same as you, as we've talked about, they've potentially talked to primary care, or they found their information on the internet.
Mm-hmm.
They found us on YouTube. They were looking online. They started searching, where do I go? Who does sexual wellness? Who does hormones? Who does peptides? Whatever it is that they're looking for, and they're finding us through online means, through our podcast. But it's not often that guys come in saying, my friend referred me.
Yeah.
With women, we get more of that.
Mm-hmm.
Women are having more conversations with each other and are discussing it more.
Yeah. And they just have, I don't think I've ever heard a man say, I've had this open conversation with my buddy and, he told me where to go. And so they're not having those conversations with friends or family.
Not for sexual wellness. Now, hormones, I've had guys that have come in and said, hey, my buddy's on testosterone. He told me to come see you.
Oh, yeah.
But it's not hey, I told my buddy I'm having a hard time getting and maintaining an erection, or I don't have sensitivity, and he said, come check you out. That just doesn't happen in the office.
No, I think they are more open to saying something about the little blue pill, because I've heard that conversation open in social circumstances where it's like, what is it that you do? Oh, I thought that was just the little blue pill. So there's still just a lot of misinformation out there, a lot of lack of information, and we see that all the time. So again, I think it's super important for patients to be able to have a place to go to get solutions and to open those conversations and have questions answered. And so we do assist frequently patients in getting a provider that might be in an area to help if they need somebody in person and by them.
Now, women, I think, are a little bit different. They tend to have, by the time they come in, they've spoken with their friends, they've spoken with primary, they've spoken with GYN, and they didn't get answers or they were dismissed.
Mm-hmm.
So women, I feel like what I see in practice, they do reach out to other providers. It's just not treated. They feel ignored or dismissed by the time they come to us, and they are a little disheartened by the medical system oftentimes.
And I think it depends on the woman. I would say about 50-50. Like 50% of women have sought care, but it's related to like brain fog, energy, maybe sex drive, but not when it's not in the details frequently, of decreased orgasmic sensation, laxity,
Because no one's asking that.
lubrication. Yeah.
But us.
Yeah. Yeah. So I feel like they will ask, they do. We have had a lot of older women that have brought it up, and both the primary care and gynecologists that have specifically made it seem like that woman was past the time when she should be having sex. And
that is crazy to me. And that is
Crazy.
something that shocks me every time I hear it.
yeah,
I just could never imagine sitting in front of a patient and telling them, "Oh, well, you're old enough at this point. It's not a concern
yeah. You
or
still
something
have
you shouldn't
issues.
worry
Yeah.
about."
Yeah.
Intimacy is so important at all ages.
Yes. And again, 40 to 50% of women, so about half of women will experience some form of sexual dysfunction. And like we said, it's a spectrum. And so avoidance of sex would be one of the first things that they do just when they start to recognize. And you can fake a lot of things, but it's hard to fake pain. So then they really start to avoid. So all of that is something that can be avoided easily with regenerative procedures. And so if you love sex, you want to continue having sex indefinitely and happily for the rest of your life, that is definitely something that can happen and does not have to change with time. And there's lots of solutions out there. And so, and that number of 50% gets even higher if you're postmenopausal. And there are books and there is consistent information out there about the fact that sex changes after menopause and lubrication is necessary and orgasmic strength goes down, and it's not about, the orgasm, it's about the connection. And so none of that has to change just because you're menopausal. Doesn't have to happen.
So what are some of those things? We talk often about hormone replacement therapy. For men, it's balancing testosterone and estrogen. For women, it's balancing testosterone, estrogen, and progesterone. That's very simplified, but hormone replacement can play a big role, but even more so is the regenerative. And we do a lot of that in our office, and we offer between laser treatments for regeneration, PRP, so platelet-rich plasma to help with regeneration, exosomes. I mean, there's so much out there. There's peptides. I mean, there is so much out there besides traditional medicine for men, a little blue pill, and nothing for women.
The little blue pill is just an option of one of the many options
But it doesn't fix the
available.
problem when there are things that can fix root causes.
Yes. And so with hormones, there's hormone receptors in all tissue. So the female sexual, instead of reproductive system, the female sexual system, the male sexual system, like there are receptors for all hormones there. But if you can regenerate the tissue as well and improve blood flow and nerves, then that's what Faraday's talking about, where it's different for men and women. They experience different things. So for men, we're doing mainly acoustic shock wave to communicate with the tissue, and then we'll do laser heating and vaginal laser rejuvenation for women. But yeah, those PRP injections and using platelets
men
or
and
exosomes
women.
or stem cells to regenerate for men and for women is super important. And then PT141 is a peptide. We've had videos and podcasts on that. And then, the little blue pill, Viagra, Cialis.
It's just one tool in a toolbox.
Yes.
But it is not regenerative. It's not going to fix what's going on at a tissue basis, a cellular basis. It's just a mask.
Yeah.
And at some point, we see you guys in the office and the little blue pill doesn't work anymore. We want to get you before that point. You want to see someone prior to that point because it's a lot easier to start working on regeneration when you have healthy tissue than on the back end where you've waited so long and now we have a lot of work to do.
Yeah. And there are ways and supplements you can take that also enhance the ability of a PD5 or a little blue pill to work. And we've done podcasts on that too. So I would say that the important thing is that there's so many issues that are out there, and sex is a core, it's a core activity connection that connects both men and women. And even if it's a solo thing, people want to experience that sensuality and orgasmic, sensation over
And all the
time in a
benefits.
lifetime, and all the benefits. Yes,
we've done podcasts on, which you can look up at benefits of orgasm for men and women.
Yeah, so this will change. It depends on the man and the woman. But what I like to say, and what we've said over years, is that even in couples that people come together because they're intellectually connected, they're emotionally connected, and they're physically connected. And obviously, the physical part plays a huge role at the beginning of any relationship. So our job is to bring couples back together. So they're still emotionally, they're still intellectually connected, but over time, a woman might become more lax. She's had childbirth. She has decreased orgasmic strength,
It's
arousal, pain, and
disinterest.
Yeah, and it takes her longer. And then we have a man who has decreased erectile tissue and strength, and it actually also might come and go faster. And so he's trying to rush through it. She needs a little more time. So it's a misfit physically over time. And we like to bring couples back together so that they fit physically again.
And a place
so,
to have these conversations.
Yeah. So I would love to open the conversation. You always really enjoy reading through the comments. Let's open the conversation in comments. Let us know what you've experienced. Does your primary care doctor, your urologist, or your gynecologist talk to you, ask questions on an intake about sex? Because there isn't a lot of sexual education in traditional medicine, but has that changed at all in our offices, entering that into a conversation when you go for your office visits? So let us know what your thoughts are. We love to hear them. And again, let us know if there's anything else you want to talk about, because we are willing to deep dive into anything sexual wellness or wellness.